Thank you for inviting me to participate in this forum. Congratulations and thanks to Kaiser Permanente, the American Heart Association, the National Business Group on Health. Supporting healthy choice is crucial to the health of our country. Healthcare organizations can focus on clinical preventive services that have the greatest health impact. For example, Million Hearts is a coordinated public-private initiative that will prevent 1 million heart attacks and strokes in the next 5 years. We'll do this by improving health in communities and improving care in clinical settings. In communities, we'll reduce tobacco use, improve nutrition by reducing trans fat and sodium, and in the clinical setting, we can improve the ABCs, aspirin, blood pressure, cholesterol, and smoking cessation. We know that we can do that by 3 core ways: focus, health IT, and team-based care. We've seen great examples of successes. For example, Kaiser Permanente Denver helps patients control high blood pressure and improved their control rate from 61% to 83%. We've also seen this kind of dramatic improvement in small practices elsewhere. But it's not only the clinical setting where we can make a big difference. Clinical providers can offer referrals for structured lifestyle change programs, such as CDC's National Diabetes Prevention Program, or QUIT lines. The National Diabetes Prevention Program works with public and private partners to establish evidence-based lifestyle change programs for people with prediabetes. We know that the Diabetes Prevention Program, with modest behavior changes, just improving food choices and increasing physical activity so that people lose 5 or 7% of their body weight and get at least 150 minutes per week of physical activity, can reduce the risk of developing diabetes by 58%. Your theme, supporting healthy choices from clinic to community, is right on, because we need to work in clinical settings and we need to work in communities. That's what we're doing with the Million Hearts campaign. Changing the community, promoting things that make it easier for people to get physical activity, easier for people to avoid tobacco, easier for people to live healthy, is going to be so important in making sure that people are healthier in communities and that clinical care is more effective. Important changes include promoting healthier eating, ensuring that the food that the government purchases is healthy, for example, making healthier food affordable and available everywhere. Changes in communities can promote healthier eating, making healthy foods affordable and accessible, can eliminate food deserts in poorer areas, can set up farmers markets, can encourage healthier food and drink in schools and workplaces, and in fact, anywhere where the government buys food, we can encourage healthier food environments, making it easier for people to eat well. We can also promote and integrate physical activity into everyday life, whether that's in schools, workplaces, or communities. Physical activity has many benefits. In fact, I think of it as the closest thing we have to a wonder drug. Being physically active reduces blood pressure and cholesterol, improves control in patients on medications, reduces the risk of type 2 diabetes, reduces the risk of cancer, increases the chances of living longer, and prevents and reverses depression even if you don't lose any weight. But most people don't get enough physical activity. We need to change the physical environment to make exercise easier, safer, and more convenient. Urban design and land use can increase physical activity, encourage active transport as part of getting around. Street design can make walking and bicycling safe and pleasant. Sidewalks, bicycle lanes, improved lighting, trees, all of these things can make a big difference. We can encourage people to walk, to bicycle, to be active in how to get around. We're seeing some progress. Obesity has decreased among children in several states. For example, in California and Mississippi, we've seen decreases. In New York City and New York State, we've seen decreases. We need more information, we need more data to determine what is driving these positive trends. But we know we can't wait for perfect evidence. We need to continue to build the science base while we implement what we know now. Thanks so much for what you do. Meetings and discussions like this are important for 3 reasons. They help us share experiences to figure out what's working. They help us evaluate and figure out how we can make even more progress. And they encourage us all to make more progress faster to protect Americans and help people live longer, healthier, more productive lives. Thanks very much.